Hi, welcome to the Conscious Eating Summit. I'm your host, Dr. Nancy Kroll. I have with me today Dr. Sandy Bevacqua. Dr. Sandy is a women's health expert specializing in female, pelvic, and sexual health, hormone balancing, nutrition, and blood chemistry analysis. She is also the author of A Sense of Urgency, 7 evidence-based steps to resolve incontinence, pelvic organ dysfunction, and sexual dysfunction. Thank you so much for joining me today, Dr. Sandy.
Thank you for having me, Dr. Kroll.
So I'm super excited about this interview because pelvic floor health, like women's pelvic floor health, is not something that I get to talk about very often. And I don't think it's something that very many women openly discuss. So before we jump into that, I just wanted to know if you could share with our viewers a little bit about how you got into this. Like, why is this your expertise and what you actually do with women?
Well, I have a significant personal story, and I'll give you the shortened version. But many years ago, I wasn't feeling well. I had some issues going on, and they were, part of that was immune system failure, but I ended up with a cardiovascular, a very serious condition, and I was told I had less than a year to live.
Wow.
So I actually, yeah. That's exciting, right? So I went to this big hot, the specialist in LA, flew out there, and he gave me 6 months to live.
Oh my gosh, it got even smaller.
Right. I told him I liked First Opinion better. And I literally flew back to Tucson and went to go see my general practitioner. And you have to understand, this was like 22 years ago. And in those days, I mean, this was like dial-up was just starting, okay? There wasn't a lot, there was like internet really didn't exist. What was in there was very little. I flew back to Tucson. I'm trying to get information, so I went to a doctor that I trusted, which was my family doctor, and literally flew to Tucson, went directly from the airport to my doctor's office. And I said, I need to see her. And they said, she has no appointments open. And I said, well, that's okay. If she can't see me tonight, I'll be right here in the morning. So they were like, oh, in her off in there. And I said, here's my blood chemistry. What do you think? And she said, well, and I've already had 2 specialists tell me I have less than a year to live, right? She looks at it and she says, wow, this is very significant. She said, let me make some phone calls and I'll get back to you. The short story is she came back and she gave me 4 different programs. She said, Andy Weil's group is doing this naturopath, this group from Germany. She agreed with me that the medications that were being recommended were not going to care for what was going on with my blood chemistry. It was really bad. So I jumped into a world I knew nothing about into foods and nutrition to be able to care for myself. Mm. And although my first attempts in following all 4 of actually I asked her, which program should I do? Which one's going to work for me? And she said, you're so bad, do them all. You are a time bomb. There's no question about the fact that you're leaving. So I had 3 physicians telling me I'm going to die, and I felt really bad. Mm-hmm. I felt awful. So I was one of those early progenitor people making the gray-green shakes and trying things. Actually, when she first handed me all those programs, that's not medicine. Clinicals, it's working. So I said, wow, should I get around group lipids and all these strange things on these lists? I had no idea what I was doing. So I was not only making these weird shakes, and my husband wouldn't even come in the kitchen in the morning. It was bad. I had to find my way back to good health with almost no direction because nobody was doing this at that time. So I spoke to some dietitians and nutritionists, and I got very, very bad information. So I started speaking to PhDs like myself, but they are in Europe, in Canada, in Japan. There's some absolutely amazing
Excuse me.
Food sciences laboratories in Central and South America. And doy conferencias en español. I'm quite fluent in Spanish, so I was able to, and I'm pretty good in German. So I was learning from these different places and getting all kinds of papers, publications translated, and taking on the study of nutrition and food sciences like a second PhD. Well, bottom line is, I found my way back to good health. I found a program that completely brought me back. And unbeknownst to me, what I did was detox my body. I did detox with the care and attention of a wonderful woman that's kind of like a curandera. Actually, she was somebody that came into my life, told me that she could help me, and then I found out that there was, I wasn't impressed. She was doing a business out of the bedroom that her eldest son was no longer using. So I really didn't, I'm speaking to top scientists around the world. So I kind of shut her down in the beginning. But then I had kind of an epiphany that I needed to go back to her, and I did. And she guided me in ways that allowed me to detox my body. And it happened fast, like within 2 weeks. My immune system came back, my blood chemistry corrected. It was awesome. And so not only did all the cardiovascular and the immune system and like autoimmune type condition clear up, but I also, I had 15 years of infertility at that time. And I was documented as someone that would never get pregnant. And guess what? I got pregnant.
Wow. That's amazing.
I had quite a number of miscarriages, and then I stopped getting pregnant entirely. So what happened was my fertility returned. I had a big baby boy, and he completely blew out my pelvic floor. And you have to understand, I have the history of being an athlete before that. So there was kind of some falls that had happened. I was sort of set up for disaster. And nobody warns you when you go and have a baby that pelvic floor disasters can happen, right? So
I don't even know if I even thought ever about the pelvic floor until after having a child. I never even, was aware of, I'm sure on some level someone mentioned it, I would be like, oh yeah, but it's not something you think about typically.
No, not typical. I got big surprises after having that baby. I was like, oh my goodness, organs are falling down, incontinence, pain, oh my God, pelvic pain, sexual pain, and just like, most of the lists that can happen, I had that, okay? So I then spent the next 12 years trying to figure out how to get my pelvic floor back together. And in my travels, I found out that I wasn't the only woman dealing with this. Like we get surprised. Nobody tells you this, right? When you're pregnant, it's like, oh, you're going to be so excited. It's going to be such a wonderful experience. It's like, wait a minute, I've got things falling out.
Yeah.
Right. And so, just the urinary incontinence alone can really squelch your style.
Yeah.
So, I went to practitioners. There were some, and during that decade, there were, women's pelvic health practitioners came about, and there became this biofeedback that you could do with probes that did nothing. I did so many different types of therapy with different types of people, and I even went out of the country. And the people that actually gave me the pieces to actually put my pelvic floor health back together are now faculty in the program that we have. So I put together a program called the Pelvic Health Transformation Program. And it's basically for women who want to be able to recover their pelvic floor without having surgery. Because the bottom line is, a lot of women have the surgeries, and many women have failed surgeries, and sometimes those surgeries can turn into even worse disasters. So the program has a faculty of 27 practitioners, and what we do is, over a 9-month period, bring women back to good pelvic health. And so that's the bottom line. And actually, the women that go through that, oftentimes they get their sexual health back. Their libido comes, and I had women coming to me and saying, Dr. Sandy, you know, my libido is back. Like, what do I do with this?
Yeah.
Okay. So we started a program some years back called The Mystery is Over, Understanding Female Sexual Health. And it started off as a very basic program. I was just teaching, you know, the different tissues involved with our sexual health and how to achieve the first basic 7 orgasms that women can have. And but then the speakers that were brought into that, we now have a big faculty. We have a program. So these are some of my passions, okay? And what happens women get their pelvic health, it is sexuality and vibrancy throughout life. So well past menopause. So this is not just for the young women, this is for the mature women as well. And it's transformational to bring back pelvic health and sexual health. So yeah, I'll leave it at that.
I was going to ask you, whenever you're going to other countries, from what I've heard, that they actually prioritize pelvic health for women more than in the United States. Isn't it a part of normal postpartum care to actually go to like a pelvic floor rehabilitation or not? Is that true?
Actually, and I forgot about that. We have another program that's specifically for women that are pregnant or had pregnancy or are planning pregnancy. And what we're using is a lot of the European, and there's a lot of training in many countries that women get to have while they're pregnant to prepare their body for the birth and to make it easier, and also for after postpartum to be able to get all the parts back together the way they're supposed to be. And so as I did all that traveling, we gathered together information from all kinds of healthcare practitioners and doulas and midwives, and put that together in a program. And so, you know, we can actually teach our perineum to fall away in response to pressure so that when the baby comes, we can open more naturally. You know, episiotomy need to be a thing of the past. Babies, our bodies are meant to have babies. And everybody knows that when you have that second baby, it can be easier than the first, or most of the time, not always. Yeah. You know, every birth is different, but we can make it easier on ourselves if we have training before and after birth. It's incredible. And so, yeah, I mean, I hope I'm coming across. I have a lot of passion about the pelvic floor and about helping women not become the disaster that I did. And what I want to do is put the Pelvic Health Transformation Program out of business by teaching women to prepare themselves. And we can do that kind of preparation before and you know, during the years that we want to be athletic, and also to prepare for and during and after our births. So if you have really good pelvic floor health, what that means is that the pelvic floor needs to be coordinated and balanced. Imagine, for instance, I'll do a comparison here. Imagine that you hurt your right foot your right foot's hurt. Maybe you broke your foot, and you're going to, in recovery, maybe have crutches, or somehow you're going to be putting a lot of weight on your left. The left leg's going to get stronger, and the right leg is going to get weaker. Well, let's say that we have a baby, and the baby, in the process of having that child, we get the front part, the anterior part of our pelvic floor kind of squashed. That's what happens when a baby comes and squishes all the tissue in between the baby's skull and our pubic bone. So we can have a lot of damage to those tissues. And you can imagine that the muscles of the area and the fascia can get very weakened and stretched out. So we have imbalance. Now, in my case, my son spent the whole time on the right side of my uterus. He blew out the right side of my abdominal muscles. So I had more imbalance than most. And that was very exciting and caused a lot of problems. So I had imbalance on the side of the pelvic floor and the front, and there was problems. So just like with your feet, if one side gets weakened, the other side gets stronger. But when we're men's, we can see when we're working on the right side. You can exercise the right side and get it back to where it should be. And we can, take some of the weight off of the left, and eventually walking, we can make the two sides equal. But we don't do that with the pelvic floor. So what are women told? To make their pelvic floor strong, you're supposed to do a Kegel exercise, right? Do your Kegels, get strong. Well, guess what? If you take a woman that's had a baby, or for any reason, if she's had a sports fall, if she's had any kind of major event that's happened to that pelvic floor, and she starts to do Kegels, is she going to use the weakened muscles, or is she going to use the muscles that got strong to make up for the weakness of the other muscles?
Yeah. So she doesn't know how to use the weaker ones probably at that point. Yeah.
She might even be numb. She might not be able to even feel those muscles at all. She might have lost touch with the sensations in her vaginal tissues as well. She might have lost all kinds of sensation. So she's going to use the muscles that are strong, right? So how are you going to redevelop balance in that very complicated structure of that pelvic floor and pelvic basket? Not possible. So the first thing that we do in the program, I'm giving you one of the answers, is we find where the lines of tension are. And I teach women, we have a patented process of how to teach women how to find where the tight, strong areas are, and to allow those to relax a little bit. And we have ways of waking up the areas that are weakened. And so that the brain and those muscles and tissues can start talking to each other again. And in the process, we get the weak areas stronger and the super strong areas to back off a little bit. And then we get a balanced pelvic floor. So once you have balance in that area, what happens is, and there's starting to be some really good research to measure this, we have energy that flows through those chakra energy centers, the meridians that come up. What the Chinese practitioners are looking at is movement of qi through the meridians. This completely changes, and the energy flow through the body completely changes. We know that blood flow changes, lymph flow changes, and guess what? The sexual tissues also wake up. The opposite is true as well. When we exercise the sexual tissues, it helps the pelvic floor stay balanced and encourages this energy movement as well. Does that make sense?
Yeah, that does make sense. Yeah, I'll share with our viewers a little bit about my story, which I haven't talked about to anyone outside of you, I think, earlier. But, after I had my son, I had a quite a large child as well. And I remember 2 weeks postpartum trying to do my yoga practice, and I you know, used to I would hover my legs off the ground, and I literally couldn't move, right? Like I couldn't lift my legs off the ground at all. And then I was like, oh, there's something wrong, right? And I remember going to my OB-GYN, and I also felt like, I felt like I had like a little bit of a lower belly pudge. Is this typical with the pelvic floor at all? Is there any structural stuff? Yeah. So I said to her, like, is this, you know, structural? And she's like, no, that's fat. Okay. And like, I'm not a very big person, right? And I'm like, oh, okay. And she told me to do the Kegels and kind of just set me on my way. But like, I did those, they didn't do anything, right? It took me, and as I mentioned to you, I think eventually I'm going to do your program just to like really get to a place in my life where I know as an older woman, I'm not going to have urinary incontinence. Cause I think even women that don't have babies have that later on in life. Because there's a weakened pelvic floor, but it took me a long time to feel comfortable in a public yoga class, postpartum. And I think, and, you know, I had another girlfriend who, she had, what was it? Uterine prolapse after her second child. And I think it's just a lot more common than anyone talks about. And I saw on Instagram, they're creating kind of like Thinx panties, you know, for periods, but for urinary incontinence. So, I mean, I just feel like it's becoming a bit of an epidemic in the sense that women aren't actually being educated that they can get to the root of the issue. And they're, you know, dealing with this secondary issue as the symptoms. Yeah, so I'm just curious, like, the type of clients that you work with, do they tend to be all ages?
Oh, all ages. Listen, 30% of our 30-year-olds have pelvic floor disorder that's powerful enough or severe enough that it's actually affecting their lifestyle.
Wow.
And 78% of your after 65 crowd, your mature women that are postmenopausal, have significant pelvic floor disorder that is affecting them. And there's something more. It's not just about having the organs where they belong and having good control over bowel movement and urination. There's urinary urgency, there's pelvic pain syndromes, there's sexual pain syndromes, there's a greater tendency towards urinary tract and bladder and kidney infections as well. But there's something else, and that is a well-functioning pelvic floor is going to affect the structure of the body in such a way that it's going to affect a woman's ability to have balance, to be able to hold our bodies upright and to be able to stay physically active and move. And so if the pelvic floor is not well balanced and you don't have that good energy, and if you don't have coordination happening in the pelvic floor, it completely affects the structure of your body in many ways. So the woman is more likely to get into that, shoulders forward, neck forward.
Okay. Yeah.
Right. Pelvis can get tilted. All kinds of strange things happening in the lower back. These are associated with pelvic floor imbalance. And women that have imbalance are more likely to fall down, go boom, and lose their lives, essentially, either die or lose their quality of life by having femoral fractures, or just bumping their heads and getting, there's all kinds of things that can happen when you fall down and go boom, right?
Yeah.
So we don't want to fall. It's significant falls later in life that oftentimes that and incontinence are the two main reasons why women lose their independence later in life. Incontinence is actually number one. So let's not do that. Let's set ourselves up so that we can have awesome health later on in life. I'm in my 60s. I'm still a competitive extreme skier. I still ride crazy horses. I'm an athlete. I'm a runner. And the reason I can do all of that is because I got my pelvic floor back. So I really want to encourage women to do that sort of thing and to find anything that's keeping you from your best health and then attend to it in whatever way that you can and in a way that you know intuitively is right for you.
So I have a question. I know that your program is, I think you mentioned, how long is your program? It's like 9 months, you said?
Well, it's 9 months, and that program does include those other 2 programs. So if women want to participate in with the pregnancy class, that's an option for them. Although other women will come into it that do not have pelvic floor disorders, that are not in the first. And then the Mysteries Over Understanding Female Sexual Health, that's also included in the Pelvic Health Transformation Program. But there's other women that just want to know about their sexual health. And so that's a very popular program.
Okay, so I know that the program is really long and it's extensive and there's tools that everyone learns, but is there, like, if someone watching this video, if there was one suggestion that you could give them in terms of something they could start doing right now to start strengthening their pelvic floor, is there anything that they could, is there any like 1 or 2 things that they could actually start doing?
Yes. Okay, I talked to you about balancing the pelvic floor. One thing that a woman could easily do is walk. Walking is an amazing exercise. There's breath exercises that we have as well that are really, really helpful. But there's a little bit of training that has to happen with that. But walking is something we can all do. And if you can pay close attention to walking evenly, and I know that some of you ladies, if you've got imbalance in that pelvic floor, you might not be able to walk evenly, or your pelvis might seem a little bit twisted or cocked in one way or another. But if you can practice, like maybe doing a marching step in front of a mirror and keep it even, maybe put on some music, okay, and then go for a walk. That's going to be much, much better than doing Kegels. Kegels can really make it worse. Actually, I want you to tell me, Dr. Nancy, did the Kegels make you better, worse, or did you not notice?
You know, I was pretty bad, so I would say they probably didn't do anything, right? I mean, I don't think I got worse because I don't know if I could have got, well, I guess getting worse would have been a prolapse or something. I didn't get that bad, but they definitely didn't do anything. No.
Okay. I can tell you absolutely for certain. And I was like, I'm so type A, right? You know, they said, do Kegels. I'm like, I'm going to go do those Kegels. And I did, and I was like, I had a little note on my steering wheel. Every red light did my Kegels.
Yeah.
I was on it. I definitely got worse. And I started having much more pelvic, radiating pelvic pain. Much more pain. It was awful. So the Kegels made me worse for sure, and I've run into that an awful lot. So I'm going to say that if you have, okay, I will get to it later on, but I'm giving a free gift, and I want you to go through that free gift and see if you can identify with any of those things. But if you have any of the early warning signs, I don't want you to do Kegels. It can definitely make you worse. And the other thing is, a lot of women find that after having a child or after that injury, sports event, a fall, what can happen is it may be more difficult to have a bowel movement. And I know we don't like to talk about these things, but it might be tougher to have a bowel movement. So what I want you to do, books, get her up in front of the toilet, get your knees higher than your pelvis when going to make a bowel movement. And what will happen is we can give the rectum some support because I'm noticing now that even a lot of the young women that have had their children, part of the problem with the uterus and possibly the bladder has to do with a malposition of the rectum. And I'll explain it briefly. The bladder, uterus, and rectum all like line up in the body like little puzzle pieces, and they have to be centered and they hold each other together. So like, okay, so for me, my son was over on the right side and my uterus landed on the right. Well, guess where my bladder went? Over to the left. Well, the whole puzzle fell apart. You see what I mean?
Yeah.
Everything kind of fell down. So that was what happened for me. I'm not saying that, you know, a uterus can go in many directions. It could go left, right, it could fall forward, it can fall back. It can fall back and slide forward into the bladder. There's all different malpositions. In fact, you know what I need to make available to your population? I just thought of something else I need to give everybody, and that is I'll give a video on a you know, where we can learn about some of these things. So I'll give a video and I'll give the ebook as well. I think your population will like it both. That will be very helpful, and there's a lot of great information on what the possibilities are, so you can get a visual, because this is all structural. It's structural, energetic, and it's also psychological. And that third thing I'll ask you to do. So the first thing, walking, and maybe marching in front of a mirror, is Potty Pal or getting your feet up at the toilet. That's going to be helpful. It can also help with urination as well. And the third piece I'm going to say is forgive yourself. It's not your fault that this has happened, and you can get better. And so I don't want you to feel, so many women come into the program feeling broken, and you're not broken. This can be fixed. You can be completely good health. And it's my passion and my purpose in life is to help women regain their pelvic floor health, have babies successfully without major issue, and also in sexual health, even well past menopause. So
Awesome.
That's it.
Well, thank you so much for your generosity in offering that video, because I think just the educational aspect of knowing those specific, I mean, no one knows where their bladder is in relation to their rectum, and you know what I'm saying? The average person doesn't know that. So it's very generous of you to share that. So can you share with us your free gift?
Yes, I'd be happy to. The first one that I was planning to use is the 20 early warning signs of pelvic, actually that your pelvic floor is at risk. And it's an ebook. It is very quick and easy to read. It's going to tell you if you have any issues, and it'll give you an idea of what, if you have certain symptoms, what does it mean? What is it, you know, where does your attention need to be placed? And you can find that, you'll be able to find that free gift, of course, with the email that you'll be receiving from Dr. Nancy. And also, if you can find out more information, and that book is available. And Nancy, can I give you the video, the link to the video for your email as well?
Yeah. So everything that you give me that you're offering to the audience will be in the email, and we'll just allow a link to those things.
Okay, thank you. So then you'll be able to get it that way. Or and if you have any questions, I'll say this. I will allow a 10-minute. I'll go ahead and contact WISH, WISH, the number 4, life, LIFE.com. So wishforlife.com. And if you go into, you know, you can contact me through that website. And so we'll make sure that you have the early warning signs, and then I'll also give you the 3 secrets video, so you'll have really great educational information about pelvic floor health. And again, you'll at least have the base knowledge that you'll need. You'll get some really cool pictures in there, and images that will help you to understand what's going on. And my heart goes out to all of the ladies that are dealing with these issues, even if it's just a little bit of incontinence. don't wait until it gets really bad. Go for it. Make it go away before you start having organs falling down. And you know,
Yeah.
it's not worse than organs trying to fall out of your body. It's like,
Yeah.
goodness, what is that? I mean, I hear it over and over again. And we had one lady, Nancy, that came into our program. She had had 6 surgeries in 3 years. She started off with just a little bit of urinary incontinence and a little bit of a bladder prolapse. So the bladder was just starting to come into the vaginal space. At the end of the surgery, 6 surgeries, she had a full bladder prolapse, so it was completely out of her body. The rectum was out of the body, and she had both urinary and fecal incontinence that was out of control.
Oh, no.
And well, she's perfectly fine now. She's gone through the program. She did really, really well. And I just, you know, my heart goes out because this is a very common problem. And some of the surgeries, they're using these terrible meshes that are causing damage to the organs. And there's class action suits one after the other. And now the American Medical Association has said better to use any other solution, and to start with any of the physical therapy type solutions rather than go into surgery, because there's so many failed surgeries. So
Yeah.
that's the truth. And so happy to provide these free gifts. And there's a lot of information there for everyone. And I talk about the Kegels in the video as well.
Great. I had one last question for you. If you could share with our viewers, if you could do anything different in your youth, what would it have been? Like if you could give your younger self advice, what would it be?
I'll tell you, I think that when I was younger, I didn't know to follow my intuition. I didn't know how to. I didn't have great training in how to follow my intuition. And the intuitive knowledge is very deep. So what I'm going to say is, ladies, if you can get training if you need to. You might not need to, though. You might know exactly what I'm talking about. Not the, it's not the messages that come from the peanut gallery. It's the messages that come from a deeper place than that. Listen to those. Even when they're a whisper, that's going to be your best guidance. So feel like something's really right for you, then do that. And that's what I wasn't doing as a young lady, but I do my very best to always do now.
Awesome. That's really great advice. I think there's so many of us that have stopped listening to that inner voice. And I think that's, you know, especially as women, I think we have a more innate ability to listen, and I don't know if we're listening as much as we need. So thank you for sharing that. Dr. Sandy, I wanted to just genuinely thank you from the bottom of my heart for sharing all that information with our viewers. The pelvic, you know, I was super excited to share about the pelvic floor because I think it's something that most women are not thinking about or addressing enough. So thank you for sharing your expertise, and being so genuine and generous with the gifts that you're offering. So thank you.
You're very welcome. And I want to welcome people to stop by at the website. We have all kinds of fun things that are happening. We have outings. We have detox outing that's coming up in June, and we've got membership, and there's all kinds of fun things there. So I welcome you to come and visit. And if you, like I said, if you want to have assistance, I'm going to place a few spots aside, Nancy, for your ladies, if there's any quick questions that I can help people with, or maybe I'll just get you pointed in the right direction. It'll give us a few minutes to see what's going on for you and give me a chance to help out. So, you know what, Dr. Nancy Crowell, I'm so excited about the work that you're doing. I'm very happy that I could be here for you and be of assistance to you, because what you're doing is very, very important work. And best of luck to you.
Thank you
Take
so
care.
much. Thank you. And thank you all for joining us today. Please check your inbox to find the links for today, and then check your inbox tomorrow for tomorrow's interview. Bye. Oh.
Bye-bye, everyone. One more thing.
Yeah.
I'm excited about the fact that you've got, aren't you going to be doing a group program soon?
Yeah, I'm going to be offering a program called Inside Out, a 5 Elements Weight Loss Cure.
Yeah, that's really exciting. So I'm looking forward to that. Thank you very much. And I'll be getting people in touch with you for that.
Awesome. Thank you so much, Dr. Sandy.
You're welcome. Take care, everyone.
Okay, bye.